Nevada, like many other states, is working to implement the requirements of the Affordable Care Act. It requires states to set up health insurance exchanges to help you or small businesses get the best bang for their buck in health insurance. News 3's Marissa Mike has been checking out how the exchange will work.
Jim, this program will be up and running by fall of next year. Now the clock is ticking for officials to put together a program that will enable you to access affordable care.
Affordable health care at your fingertips. That's the goal of the Silver State Insurance Exchange and Dr. Ron Kline.
I take care of kids with cancer and blood disorders.
One of the exchange's board members is helping to set up the program.
It's a group purchasing organization. It's a way of consolidating individuals and small businesses so together they can purchase insurance for a lower cost.
Officials are recruiting insurance companies and working around the clock to spread the word about the insurance resource set to be ready by October of next year. The exchange can be used by the uninsured and small businesses with 50 or less employees.
More people can afford to get care, and it doesn't bankrupt people. Their medical care doesn't bankrupt them. That's a positive thing.
The feds are sending Nevada about $25 million in grants to get the exchange up and running. But once those funds dry up, the program is on its own. So who will fund it after that? The people who use the service.
The health insurance exchange is responsible for taking care of itself financially. And the most likely way we'll do that is by putting a surcharge on the insurance products that people buy through the exchange.
A surcharge of about $10 per month. But before you cringe too much, Kline says it's not as bad as some would think.
A lot of the people who are buying products through the health insurance exchange are getting federal subsidies. So even with the additional charge that keeps us going, the overall cost of them should be less than outside of the exchange.
Depending on how much a person makes or a family brings in, applicants can receive subsidies. This isn't a program only backed by the left. It has received bipartisan support because it drives people to pay for insurance instead of solely relying on the state's public health care programs.
We have insurance companies, or insurance products I'll call them, that are going to be available to these people who are opting for an insurance program instead of a Medicaid program.
In 2014, organizers expect 134,000 people to use the exchange. That number is expected to grow to 200,000 over the following 3 years. The first date of insurance coverage purchased through the exchange is January 1st of 2014. Jim?
If it works like it's supposed to, it sounds like it'll be a great resource. Marissa, thank you.